Alright, my name is Frances Hammer. I will be doing the video for the urinary catheter on a female. So the first thing that I would do is check the patient's chart for an order for the urinary catheter. I would also check to see if she has any allergies, and I would check to see if she has any mobility limitations. If she did, I would see if I could get assistance from either an aide or another nurse, and I would gather my supplies, and I would knock on the door. Knock, knock, knock. Hello, Miss Smith. My name is Frances. I'll be your student nurse today. I would close the door to provide privacy. I would make sure that there was adequate lighting coming into the room. If there was not, I could use an artificial light source like a flashlight or a lamp. I greeted the patient. I would explain to her that she has an order for a urinary catheter and what that would entail. I would tell her that it will take about 30 minutes, and then I would gather or bring my supplies over to the table. Okay, I would raise the bed to a comfortable working height. And then I would lower the side rail. And I would get the drape, and I would explain to Ms. Smith that we were going to get her cleaned up, and then we would do the catheter insertion. I would ask her, I would do my two identifying things and ask her name and date of birth. And I would also check her bracelet, her medical bracelet, to make sure that everything matched up. Yes, then I would ask her if it would be all right if I took down her blankets so that we could get started. So I would take her blankets down, and I would raise up her gown and give her a drape for modesty to cover anything that didn't need to be exposed. I would then assist her into the dorsal recumbent position with her knees up and slightly bent, and her legs would then be abducted off to the side, and then I would get a waterproof drape to put underneath her. And if she was able, she would help me by pushing her feet into the bed and raising her hips. Be careful. Make sure I don't rip off her leg. Okay. At this point, I would get the water that I have for her, and I would sanitize my hands and then put on a pair of clean gloves. I don't know if I said that I would do hand hygiene when I came in, but I would do my hand hygiene when I came in. And I would do it again, and then I would put on a pair of clean gloves, and using warm water, washcloths, and skin cleanser, I would clean her perineal area. I would use the washcloth like a mitt and cover my hand, and then I would use a clean portion of the washcloth for each swipe, or use a separate washcloth for each swipe. So I would go from the top to the bottom, and then get a new corner of the washcloth and do the same thing on the other side. New corner, same thing. Then I would get clean water to rinse, and I would do the same thing again with the mitt on my hand, and I would wipe down the middle. Then a new washcloth or a clean corner, I would do the same thing on the opposite side, and then wrap it again and do on the opposite side to rinse her skin of the soap. After that, I would get a dry towel and I would pat her dry. And then I would remove my gloves and sanitize my hands again. After disposing of the used washcloths and the basin and anything else that I didn't need anymore, I would move that off to the side. I would sanitize my hands again and start to set up my sterile field. I would use the bag from the kit to use as a garbage can or a garbage. Oh, I would not poke a hole in it with my finger. Dispose of that. And then I would open the container using the sterile technique, opening one side and then the other, and then this side, and I would pull and turn. Then I would get my gloves from the kit, and I would open my gloves and put them on. Then I would get my second glove. Okay. I would dispose of that. And I have my sterile gloves on now. I would move my box slightly so that I could open it, and I would take out the drape and carefully, without touching it to anything, including my body or the sterile field, I would open it and I would cuff the drape over my hands to protect them, and I would put the drape down. Okay. If by chance my hands became contaminated or the drape became contaminated, I would have to start over and make my field sterile again. I would then take my other drape and very carefully place it over the patient. And it would go over her perineal area, making sure to expose the labia. Okay. I would then open my items to make sure that I had everything that I needed for this procedure. Would open my urine sample and put the label where I could reach it. I would open up my swabs and I would open up the lube and put some into the box with the catheter. So the lube is in the box. That is done. I would then take the sterile saline and remove the cap and put the sterile saline into the port to inflate the balloon. I'm going to move my box to my other sterile field. Without touching the patient and without contaminating anything. Okay. Then I would identify the meatus and I would spread the labial folds. Much more complicated than it looks. Okay. And then I would use my dominant hand to get a swab and to clean the labial folds one at a time, using a clean swab with each swipe. I would do the outside first, then dispose of the swab, and then I would do the next side from top to bottom, dispose of the swab, and then I would cleanse the meatus down from top to bottom and dispose of that swab. Then I would take the catheter and I would put lube on the first 2 to 3 inches of the catheter, and then I would insert it 2 to 3 inches into the patient. Once I got a flash of urine, I would put it in another 2 to 3 inches, and then I would inflate the balloon with the sterile saline. Very slowly and carefully. With the full 10 milliliters of sterile saline, balloon would not have burst. And then I would take off the syringe and I would dispose of it in the sharps container. Okay, so I have her catheter inserted. I would then gently with my sterile hand pull on the catheter to make sure that it did not come out and that there was a little bit of resistance. Then I would remove and discard the supplies, and I would, there we go. Okay. I would remove and discard the supplies. Then I would then I would cleanse the perineal area again and make sure that she was clean and dry. And I would then remove my gloves. I would perform hand hygiene, and then I would use a catheter securement device to secure the catheter onto her leg. I would make sure that she could move her legs around and that it didn't pull, wasn't uncomfortable for her. And then I would help her into a comfortable position, and I would move the bag off to the side, and I would assist her remove the drape, and then I would get her gown pulled back down and put her covers back on her. I would, at this time, put on a clean set, or I'd do hand hygiene, then I'd put on a clean set of gloves, and if the order called for it, I would get a urine sample. Because this is a brand new collection bag, I can take the sample from the bag, and I would label it with the time, date, and the patient's name, and get it down to the lab. If I couldn't get it to the lab immediately, I would take it and refrigerate it until it could be taken down. And before putting the catheter in, I would make sure that the bag valve was locked so that urine would not spray everywhere. Then I would raise the side rails up on the bed and secure the bag to the side of the bed. Make sure that it doesn't interfere with the railings, which it does not. Then I would lower the bed. I would check and see if Miss Smith needed anything else. I would make sure that she had her call light and some water, and that it was within her reach. And I would dispose of all of my equipment, and I would remove my gloves and do hand hygiene again before I would remove my gloves and do hand hygiene again, and then I would thank her. I would do my documentation before leaving the room, and once everything was put away and Miss Smith was comfortable, I would do a safety check, and then I would leave the room. And I think that's everything.